Good morning, all. I see several familiar, friendly faces in the audience. So I'm looking down at the schedule and I see that each of the speakers so far and at the end are all NYU. And then who is this woman from Columbia? So I kind of snuck in a friendly way. Kathy Joseph was my breast surgeon when I was diagnosed in 2008 with DCIS. Microinvasive, so it's kind of stage 0, trying to be stage 1. So as far as I look out, we're all in the same tribe, yeah? And my topic today is nutrition issues for any woman who's going through breast cancer, from diagnosis through the goal to try to protect yourself from a recurrence. And while I have been doing nutrition education for a million years, I want to make sure I let the nutrition information come to you in the most realistic perspective. So I sort of do the analogy of, if you're in a room and you're lying down and the room is chilly, we could go all the way to say the room is cold, what can you do about it? You can make sure your heater's on right. You can make sure your windows are closed. Or hopefully your windows aren't leaky and wind is coming in. But what you can do for yourself is get a blanket. That's proactive. You have the choice of how much you can wrap yourself. And I see nutrition in almost all chronic diseases, including breast cancer, as the blanket. That's what we can do for ourselves, because there are circumstances outside of where we are that are perhaps genetic, could be environmental, and some of those are not in our control. So now we're gonna talk about that nutrition blanket. Is that a good analogy? Okay. And I'm wearing white after Labor Day, so I'm already a bit. Okay. So because I'm a dietitian, and an educator, I have to start with what is nutrition? And nutrition basically means how food turns into you. So as I joined the rest of you this morning, eating some yogurt and some granola, having a little coffee, really trying to eat as much papaya as I could without looking greedy, all of that food is now in us, and it's being processed, and some of it the vitamins will go into various pathways to help us generate energy, the minerals will go into various pathways to help make new bone. We'll use fiber for things, we'll use protein for things, and then the parts that the body doesn't need, we'll get rid of in a few hours, 24 give or take. So nutrition is the process of how food turns into you. And just like Dr. Joseph said, you kind of are what you eat. If you eat a vacuum cleaner, you won't turn into one, but the quality of what we eat will affect the quality of what we build. And our goal at this point is to try to stay strong by giving our bodies the nutrients that we need. And we also want to make sure that we can accommodate any changes in our appetite and in our energy level during treatment as well as after. And we want to get lots of fluids, lots of protein, and lots of calories, because those are the things that are going to support our immune system. So my images on the left represent fluids. Not pushing fruit juice. I'm not actually pushing juicing. I'm just talking fluids. So water, infused water, if that may be your thing. When I say protein, we mean foods such as beans, fish, I say it in order just to get your attention, all the dead animals. Okay, beef, lamb, veal, pork. And keep up good calories, which means make sure you eat whenever you can. Keep the plate going. So during treatment, some of the things we experience, and it may depend on what your treatment is, but nausea or vomiting. And some of the ways to help relieve that or manage it better is to have smaller and more frequent meals. It's almost silly to say it, because when you're nauseous, the whole idea of a big meal is completely out of the question. But those around us may often put food in front and say, here, you need to eat. And it's just remember, smaller meals and perhaps more frequently. A cold food, or at most a room temperature food. And by the way, cold refers to the room you're eating in as well as the food you're eating. Eating in a hot room may also affect your appetite, may affect your tendency towards nausea. So comfortable location and smaller, cooler foods. You may experience taste changes, so you might try dry foods. Those are pretty obvious, things like crackers. But if you do want those protein foods, fairly dry chicken. We're not trying to impress anyone with our cooking skills. We're just trying to eat. So dry chicken, dry turkey, tofu, or even if red meat is unappealing and you want to take in other sources of protein. If you experience fatigue during your treatment, first consider how much caffeine you're drinking. It might sound like, once again, a conflicting idea. If I'm nauseous or I'm tired, why would I be drinking a lot of caffeine? Does that bother your stomach? But for some, we culturally think that cup of coffee is something that we really want every day. It makes us feel normal. It makes us feel like our routine is still in place. So it's not that coffee is a bad thing, but too much caffeine might actually interfere with your ability to rest. So keep that in mind. And then, of course, make sure you're eating enough. When you feel as though I had a little something, and before you know it, it's 7 hours later, you haven't eaten again, it's important to try to continue eating. If you're experiencing a sore mouth, chamomile tea has been suggested as a mouth rinse that has helped to reduce mouth sores that have been caused by chemotherapy. You might also want to soak your food. I know that does sound a little unusual, but see if you can help food have a texture which is easier to get down. You may chop food very fine, popsicles are fine, applesauce, and blend things with them. So when during treatment, if you may experience a weakened immune system, one of the strong recommendations, and there are actually some science that says it won't matter, but some recommendations that say try it anyway rather than take a chance, which is to avoid foods which may have any bacterial load that could bring on an infection, since the immune system may be suppressed. So raw vegetables and sprouts especially. Now I put a picture of sprouts, I think on the, maybe I didn't put the sprouts on. No, the sprouts are in the upper right. It may not be a food that you commonly bring in from the supermarket, but this would definitely be a time to leave it in the supermarket, even if you rinse them well. Raw eggs or undercooked meat or poultry. So there are some dishes in which the hot food is there and the raw egg is dropped in it. So for the time of your immune system being compromised, these would not be the ideal items on the menu. Any food that is unpasteurized, especially fruits and fruit juices and vegetable juices, and some ciders. This time of year, especially at farmers markets, there's wonderful ciders that are out, and maybe that would seem to be a nice, cool, refreshing thing, and it might work fine for most of the time, but if, again, the immune system is in any way compromised, if these have not been pasteurized, in other words, exposed to a certain amount of heat for about 90 seconds to kill off pretty much the general bacteria that are there, these would be foods you should omit for the day. Also, the last one there is tofu packed in water. This is by no means the entire list, but these are some of the probably more common foods that we might think of eating but want to be more cautious about. If you find that your taste is changing during your treatment, you might ask someone else to cook. If they're good at it, keep them. But the idea is that if you are around the smells of food cooking, it may affect your appetite and you may lose your interest. I mean, for those of us who generally cook, especially if it's a big festive meal, by the time you're ready to serve Thanksgiving or whatever, you're thinking, I already picked at everything, I don't want to eat. So it's kind of similar to that. You also may want to rinse your mouth with ginger ale or salted water. The idea here being is that you're trying to kind of clean or restart your palate. You might want to suck on ice chips. And it's an odd one to say, what's wrong with my regular fork and knife? Well, try a plastic spoon, just in case there's a slight metallic tinge to your food that you're more aware of than you might normally be when your tastes are changing. And of course, more smaller amounts, cooler foods. And when I say no spicy, I should really say spice to toleration, because listening to people describe their food patterns to me over the years, I know some who say food without spice will make them nauseous. So again, to your own tolerance, but these are some tips. So during radiation treatment, you're getting these, which was part of my journey. Yeah, that's the funny one, when you have one color here and one color here. And my husband said, we're going to nickname this one Chernobyl. You'll know if you get radiation. So those dietary supplements, we're not talking foods, but we're talking actually buying a supplement such as the one shown in the center, not by brand name, but by content. If they're rich in vitamin C, or vitamin A, which might be as retinol, or beta-carotene, or vitamin D, or E, or the mineral selenium, these may interfere with the radiation's ability to destroy cancer cells. It's a possibility. So if you're a person who likes to take supplements, just discontinue them for your radiation therapy, which is usually in the neighborhood of 7 weeks or so. You'll be just fine. And because of any potential problems, it's a good idea, again, to discontinue them until you're finished. Now, grapefruit juice interacts with many different medications, some of the chemotherapeutic agents. And in general, because I work with a lot of adults who are taking a medication for blood pressure, maybe something for mood, maybe something for diabetes, something for cholesterol. In general, they've said, well, I've been advised that the grapefruit or grapefruit juice may change how my drug works, so I just don't drink it anymore or eat a fresh grapefruit. Of course, I hate to hear myself describing any fresh fruit that you shouldn't eat, but this would be the one and this would be a conversation with your oncologist. The medication that you're on, the chemotherapeutic regimen, includes one which could be altered if you are taking grapefruit juice at the same time. But you do want to have foods which are rich in the nutrients, not the supplements, but the foods. So good sources of vitamin D and the other bone-building minerals are there. This is notably in chemotherapy. So showing here I have broccoli, avocado, almonds, cheese. I'm not sure what that is in the pink glass, but looks good to me. Okay. What was it? Okay, good. Perfect. So beyond treatment, we're trying to remember to eat protective foods. We're trying to, again, put on a blanket of things that we have a personal choice in. And so I have a quick list, and I may expand on each one a bit. Green tea. I know I was in a study that was looking at green tea and breast density. So I'm not telling you to go buy a green tea supplement, but perhaps a couple of cups or a cup of green tea may just be good in the big picture. Anti-inflammatory foods, which I'll come back to in a moment. Alcohol consumption is sort of a maybe yes, maybe no, but I'll have a second slide on that in a moment. Mostly for, I think, estrogen receptor positive, it's not recommended. And then remember to try to keep an ideal body weight. I will return to that shortly, but the summary about ideal body weight, as has been discussed earlier, is that when you have excess body fat, in particular belly fat, and this is where I'm going to hide behind the podium, it is what we call pro-inflammatory. And inflammatory signals and processes in the body seem to be associated with the potential to increase tumor growth. Now, does that mean that everybody here with a waistline above 35 inches, are we cooked? No. But there are patterns about eating that we can use to decrease body weight just slightly, but also the way we eat to decrease body weight is anti-inflammatory, and I'll come to that. Okay. Foods cooked at low temperatures. This is because of a category of substances called advanced glycation end products. It might be a concept that is pretty new to most consumers. I know I've seen a couple of nutrition newsletters that are, for general public as well as for dietitians. The idea here is that when you dry roast or heat at a high temperature, you increase the chance of these AGEs or ages accumulating in food, and consuming them could again contribute to a pro-inflammatory process in the body. And pro-inflammatory means the potential to have tumor growth go faster. All right, or initiate. And for the last two educational sessions that I've attended, there seems to be eating soy is safe. Nobody should be eating a pound of tofu or drinking 2 quarts of soy milk. But if you eat tofu or drink soy milk, eating soy foods is recommended. Or let's put it this way. If you are trying to follow a plant-based diet, you don't want to eat meat, and you're eating some tofu or edamame, it isn't going to promote breast cancer because of the way the very small amount of estrogen-like activity in soy is not necessarily contributing to additional breast cancer tumors. How's that? I want everyone to feel comfortable with that. Okay, so this basically summarizes everything else I'm going to say. So if you have to go to the ladies' room, you can go now because this is the message. If you're a man, don't go to the ladies' room. Okay. If your food can go bad, it's good for you. So what is that? Kind of wrap that around everything you know. Fresh fruits, fresh vegetables, beans. Now that is also true for chicken and fish and veal and beef. So we want to just keep in mind that if you hold up your hand, look at the palm of your hand, the size of your palm is the amount of meat, and meaning chicken, veal, pork, lamb, beef, fish, that you should eat a day. I saw some frowns like, is she kidding? That's really nutritionally what you need. And beyond that, especially if it's cooked at a high temperature, how many Food Network channels just lavish the whole idea of grilling and look at those beautiful grill marks? Well, the bad news is those are advanced glycation end products, which may contribute to the pro-inflammatory effects in the body. I'm not saying that you have to eat all your food simmered in broth, but if you could switch to more of that, that would be better. Did I keep you? Okay. So if your food can go bad, it's good for you. But if your food can't go bad, it's not. And this doesn't mean that we should never eat snacks or fun food, but this should not be the knee-jerk go-to food. So let's imagine I'm walking down the street and I hear a conversation, someone says, oh, I'm hungry, I'm going to jump in this store and get a snack. If you always come out with the Doritos, or you always come out with the Slim Jims, those are the chewy things, right? The meaty things? Okay. Or you always come out with a honey bun, you're not putting a good blanket over yourself. So you can come out with an apple or an orange, even if it's not organic. It's just light years better than the packaged stuff. How we doing? Okay. So this is a little more about the idea of alcohol, what is called a drink, and what is recommended for breast cancer in estrogen receptor is none. Estrogen receptor positive. If you end up having a celebration and you drink wine or you have some champagne, you're in good shape. Don't worry about it. But this should not be a daily thing. So one of the reasons that's described here is that if you have a family history of breast cancer, it should be discontinued. It may destroy folic acid. Now let's not forget that red wine does have resveratrol, which seems to be anti-inflammatory or an antioxidant, which is a good thing. What about some other antioxidants that we can eat from food, not taking as supplements, And these would be the carotenes, which are recognizable usually by their color. They're going to be fairly rich in oranges, yellows, and reds. Even something green will have carotene in it, but your eyes won't see it because the chlorophyll of the leaf basically masks the orange colors there. You know how in the fall the leaves go from green to orange or red? So those are carotenes that are naturally in the leaves. Oh yeah, we went biology on it. Okay, let's get back. So the idea is that the leaves don't make any more chlorophyll, and now you can see those beautiful oranges and reds and golds. So a food like the fruit we had earlier are excellent sources of beta carotene, excellent sources of vitamin C, as I have examples there. For vitamin E, excellent sources would be natural oils and whole grains. And any of the dark, pigmented, and aromatic foods and herbs. So I make a joke to myself when I'm on the subway going to work in the morning. I know what he had for breakfast. I want all of us to reek of garlic and onion and thyme and basil. All of those richly aromatic leaves are full of very protective substances. They are a gift from nature. We should be eating those more. Salt and pepper, okay, but that's the good stuff. So then there are other anti-inflammatory foods, and I've put a little bit of science at you here. They prevent elevated rates of cell division, which may increase mistakes. Mistakes is in quotation mark, because when a cell divides and it does oops, that's a mutated cell. Now your immune system knows to go find that mutated cell, smack it around, and carry it out. Sort of like the immune system is the bouncer. And the idea is you don't want to make lots of mistakes because then you may be overwhelmed, and that might be part of the pathway of some kinds of tumors. So here are those wonderful deep aromatic greens. Along the bottom are more sources of omega-3 fats, showing walnuts, almonds, fish, canola oil. Olive oil has a tiny bit. Flax and flaxseed oil are excellent sources. And up at the upper right, I think are more examples of turmeric and other very rich antioxidant, anti-inflammatory herbs. So now I'm nervous. Ready? This is the hard part. Does sugar feed cancer? You've seen that on the internet like crazy, right? I am so often confronted by people. You let people eat sugar? We're talking about the blanket, talking about wrapping yourself in the most healthy foods possible to protect yourself. The idea of sugar feeds cancer comes from the fact that a mutated cell grows more rapidly than other cells, than healthy cells. So far, so good? I'm looking at Kathy. All right. Anything that's growing faster takes calories at a higher rate. Take a 4-year-old compared to me. I would love to eat the same number of calories. So the most efficient fuel for every cell, whether it's a mutated cell that's part of a tumor or a healthy cell, the most efficient fuel is glucose. So if the tumor cells take up glucose at a faster rate, it's because that's what they're doing as they're growing faster. Glucose comes from the blood sugar. Blood sugar comes from food. So whenever we eat potatoes and rice and corn and barley and wheat and papaya and oranges and apples and pears and the lactose in milk, those are all sources of carbohydrate that contribute to our blood glucose level. None of those foods is cancer promoting. So the idea is that, well, what if I eat a high sugar diet? What if I do get the honey bun every day? What if I can't stop myself from constantly eating, okay, you guys imagine anything that comes up with being high sugar. Fruit Loops, okay. Those foods will give you what is called a high glycemic index. So that's my 4th bullet point. High glycemic index, what's that story? It means I eat the sugar turns to blood sugar. The faster it converts from my mouth to my bloodstream, the higher the glycemic index. So if I eat straight up pure sugar, I will get a blood sugar rise in about 6 minutes. Pure glucose. If I eat an apple with, this much sugar, combination of sugars, right? My blood sugar will rise in about 20 minutes. If I eat beans, like lentils, red beans, garbanzos, the works, my blood sugar will rise in about an hour. So in other words, the slower the carbohydrate in the food reaches your blood sugar, that more body-friendly it is. So let me go. Who's a high glycemic index food? Well, Fruit Loops, Corn Flakes, Honey Buns. Name some more. All the Skittles. Ice cream. Actually, ice cream, because of its fat, is kind of slow, but sherbet is high. What I want you to walk away with is, we know what is happy for our body. All those richly colored fruits and vegetables. I do not want you to walk away thinking that every time I eat something with sugar, that I should not put sugar in my coffee. I should not ever have something that's a sweet thing, because it's going to feed cancer. Cancer is feeding like every other cell. It just feeds faster. And we're not pushing it by eating foods with carbohydrate that turn into blood sugar. So I want you to enjoy as many foods, keep your appetite, keep your strength up. But I also want to note my third bullet point, calorie restriction. So here's some interesting stuff about how you eat and breast cancer. You ready? Because I went into what you eat. Turns out that if you eat less than a third of all your calories in the second, if you divide your day in morning, midday, and evening, less than a third of your calories should be in that evening slot. Okay, so what are we talking about? How many of us pick at a little breakfast, munch on a sandwich? When we get home, it's feeding frenzy time. Own it. Come on, all right? So not only do we have a decent dinner, or maybe an indecent dinner, I'm not about to judge, but then there's munchies the rest of the evening. So if I actually counted your calories, it might be that you didn't just have a morning 600, a midday 600, and an evening 600. You had an evening 1200. Are you with me? You follow this math? So the study shows that inflammatory markers are higher when you have more than a third of your calories in that evening slot. And they are associated with more breast cancer. Ouch. So that means when you get ready to go for the munchie, go brush your teeth. Because you have to tell your mouth, who cares? It wasn't going to be good anyway. You're trying to fool your mouth, actually. Also, having more of your calories throughout the day as opposed to piling up at the end is associated with lower levels of inflammatory markers, which is then associated with lower amounts of breast cancer. How are we doing on that one? So we're going to have those good foods that go bad. We're going to eat good meals throughout the day and not pile up on calories in the end, and that also helps with weight management. So a lifestyle factor that is part of how we can protect ourselves with blood. How am I doing on time? 2 minutes, okay. Lifestyle factors. And when I use the word lifestyle, I always feel like I'm kind of giving somebody the side eye. Your lifestyle, But what it was saying is the style of how you do what you do from the time you wake up to the time you go to sleep. If you do it with panache, if you spread out a placemat and have a peaceful, short morning meal, midday meal, evening meal, that's a good style. Okay. So I'm taking a quote from a study. Poor diet, low income, obesity, and a lack of exercise are established lifestyle factors that are known to increase cancer burden and are often more prevalent in African American communities. That is not to say, well, we don't care, who gives a hoot, blah, blah, blah. It means that we may not have the supermarkets, we may not have the park access, we may not have the space to do different things if it is in a low-income community with that's not well appointed. Okay, so this isn't happening as often in higher income areas, but that doesn't mean we have to live up to that. It's our blanket. Make our blanket good. So we want to not smoke. Dr. Joseph, I know, no, that's not true. In April of 1971, at about 11 o'clock in the morning, I took a puff on a Kool. Because Kools are, right? Black folks smoke Kool. I wanted to see what it was like. And when I stopped coughing, I asked, why does anyone do that twice? So do not smoke. Avoid secondhand smoke if you can and other environmental toxins. Get regular exercise, and that could be prancing and dancing. It doesn't have to be going to the gym. It doesn't have to be training for a marathon. Quality sleep, manage stress, and eat foods that support our well-being. Those are pretty good keys to help us protect ourselves from reoccurrences of breast cancer. It's helping. It may diminish the risk, it may delay, or it may protect completely. The picture on the lower right is basil leaves plus, I think it's pasta, and then tomatoes. So yes, it's sort of an Italian flag, but that's the kind of amore we should have with our food. Lots of those rich, dark, aromatic flavoring sources, lots of those colorful fruits and vegetables, and no fear of having pasta because we're not eating it by the pound. So far, so good? Okay. So steaming and poaching are protective. Remember I said the lower the temperature that we cook our foods, the fewer of those advanced glycation end products, the better. And I will probably cross the street in heavy traffic for a fried chicken wing. I will not lie. But I try not to do it often, and it has nothing to do with the traffic. It's all about the wing. So how many of us have a steamer basket? Okay. So those of you who can't remember, drop by the dollar store on the way home. The background of my sister's kitchen there has all those nice, healthy, wonderful things. And by the way, I am also someone who likes warm or hot food. Even in 94 degrees outside, I want hot soup. Yeah, okay. But you don't have to have just cold salads. Things can be as to whatever desired temperature and texture you like. So there is a bed of a deep leafy green vegetable with lots of folic acid, lots of beta-carotene, vitamin C, over an omega-3 rich source of fish. And as I summarize, it's almost as though this information is really not new, but we just need to keep reminding ourselves. Because in the 1730 Poor Farmer's Almanac, there was recommendation and advice to eat chiefly from the garden, the orchard, and the hen house. We're still there. And thank you for your time.